All right, everybody. Today we're going to review ketamine, its dosages, its uses, and some of its side effects. Ketamine's getting ready to go out on our ambulances, so I thought it would be a good idea for us to review its dose and how to use it. A little review about ketamine. Its drug class is a dissociative analgesic. The indications for it are sedation and severe pain that can't be relieved by other means. Contraindications are severe hypertension, strokes, head bleeds, head injuries with possible increased intracranial pressure, and chronic alcoholism. Some side effects are respiratory and neurologic depression and some emergence reactions in pediatrics, and we'll talk about that in a few minutes. Ketamine works mainly on the NMDA receptors. That means it changes your body's perception of the world and of pain and things like that. That's why they call it a dissociative analgesic. So it takes away your body's reaction to certain things. The bad part of that is there's no real antidote for it. Basically, once you give it, you have to let it wear off. So if you give too much, you might be in some trouble. Okay, we're going to review the protocols. We're going to start with the patient comfort and pain management protocol. You can see here that after you've given a dose of fentanyl or morphine, then if it's non-cardiac related pain, we can do some ketamine here, and that is a standing order. So 0.2 per kilo up to a max single dose of 20 milligrams, slow IV push over 1 minute, or 0.5 milligrams per kilogram IM. Subsequent doses require MCP order. This is ideal for those patients like burn patients that the fentanyl just is not taking away their pain, or the morphine just isn't taking away their pain. Severe long bone fractures where they're coming unglued and you can't really control their pain with the fentanyl. This is the kind of patient you want to give that to. Definitely not cardiac chest pains, nothing like that. We don't want to give it to anything like that. And we don't want to give it to anybody that might have a head injury associated with their trauma. So the other use for it is behavior chemical restraint. So if your patient has excited delirium, we can do some ketamine for that. So if they have extreme psychosis, can't control it with midazolam or Haldol, then you can do 5 milligrams per kilogram IM to a max single dose of 320. Or if you already have an IV or IO in place, you can do 2 milligrams per kilogram to a max single dose of 200 milligrams. So with that high a dose, you definitely got to be cautious of hypersalivation, and we'll talk about that here in a minute. But here are your paramedic treatment protocols for the use of ketamine. So some side effects of ketamine, especially in the higher doses. You got to watch out for hypersalivation. Basically, they will drool all over the place. And this is really only in your higher doses. What we have standing orders for pain dosing, probably you're not going to see this. But if you do the sedation protocol, you will see hypersalivation. So you got to be aware of that. Place the patient on their side. Be prepared to suction if needed. They're going to drool a lot. Respiratory depression, that's a fairly rare side effect, but it can happen, so you need to be prepared to manage the airway. Now here, hallucinations. Especially in pediatric patients, if you do a sedation dose of ketamine, and then as they start to come out of it, they can have really bad emergence reactions. So as that ketamine is starting to wear off, they can have a really bad emergence reaction and like see dragons on the wall and stuff. People can also take a bad trip, and they can have really severe and vivid hallucinations. So, like I said, it's more common in kids than adults, but it can happen in adults. And laryngospasm. A very small percentage of patients experience a random laryngospasm secondary to ketamine infusion. If that happens, you should just be prepared to manage the airway via oxygen administration and positive pressure. So the ketamine that we have is coming in 50 milligrams per milliliter, and here is our dosage chart. I'm going to print these off and laminate them and place them on the NARC bags of all of our units. So you can reference this for your doses. So again, just a little review of things you need to know. Be aware of emergence reactions in large doses. If you're doing that sedation dose, be prepared to put them in a cool, quiet environment. So when they come out of it, they have a less likelihood of having an emergence reaction. The half-life is around 180 minutes, though, so hopefully we're at the hospital by that time. Having a cool, quiet environment is not always practical in an ambulance. Be aware of respiratory depression in large doses. Be prepared to manage the airway if needed. And around 1% of patients will have that random laryngospasm from the use of ketamine, so be prepared again to manage the airway. Overall, it is very safe. I don't want you to be afraid of it. It's a very safe drug for pain and sedation. The military is using this, and they're dosing guys up on huge amounts of ketamine, and they're not even placing them on a monitor. So they've been using it for a while with really great success. I don't know if y'all remember the case of the guys in the cave there in Indonesia or Thailand or something. They sedated those kids with a bunch of ketamine to get them out of that cave. So with no monitoring equipment at all. It's very, very safe. The ideal patient, severe traumatic pain not relieved by fentanyl or morphine, burns, severe fractures, and that severely excited delirium patient that you can't control with normal chemical restraint. It's a very safe drug. I think we're going to see a lot of really good stuff come out of our use of ketamine. I don't want you to be afraid to use it, but these are just some things you need to be aware of. As always, if you have any questions, you can get a hold of me. Once this is published, ketamine is going to start working its way onto our ambulances. So review the protocols and good luck.